Hi, let's talk about the most exciting part of your ultrasound journey. If you are fifth month pregnant or if you are nearing your 18 to 22 week scan, then welcome to the TIFA scanning or the anomaly scanning. I'm sure you all would have heard about it. You'd have all seen pictures in the social media about the same. I feel most mothers are excited about this part of the scan, or most couples, I should say, because this is the first time you can see the baby in a very recognizable format. But the scan is not just that. For us, when we are scanning, it's the scan of the whole baby, both externally as well as internally. So externally, we look for the symmetry of the organs. We look for the limbs, how well the limbs are formed, if the limbs are measuring all right, how they should be measuring for that particular gestation, if the limbs are aligned properly, if there is no club footing, because we need to rule these conditions out. We look at the head, we look at the shape of the head, we do the measurements of the head. Then we look inside the head, we look at the brain, how well the brain structures are formed, are they appropriate for what is expected for that particular gestational age, if there are any abnormal findings. For example, sometimes you may have excess water in the brain, what we call as a ventriculomegaly or hydrocephalus. If such a finding is there, then that baby will need additional investigations, additional testing. For the same, we will need to advise you to come back to us so that we can do a thorough checkup as well as do the required relevant testing. Sometimes cysts, etc., may be found in the brain. So we make sure that the pregnancy is going in the right direction and we rule out these particular conditions. Then coming down, we look at the neck, we look at the chest, we look at the heart. The heart should be situated on the left side of the body, and that is ensured in this scan. We look at the size of the chambers, we make sure that there are 4 chambers in the heart, how the valves of the heart are, how are the blood vessels which are coming out of the heart, is the heart rate, rhythm fine, is the heart pumping regularly as is expected at this gestation. And I'm sure it's very exciting for you to look at the pumping heart as well, and also to listen to the heartbeat of the baby, which you have already heard anyway. We also look at the other organ systems like the spinal cord, which is very common site for finding abnormalities. So we look for the vertebrae, if they are all formed completely, if there are no gaps in the vertebrae, if there are no gaps in the skin covering the vertebrae. We also look for any abscences in the segments of the vertebrae, or if there are any extra segments of the vertebrae as well. Coming down, we look at the stomach, we look at the various part of the gastrointestinal system, we look at the kidneys, we look at the functioning of the kidneys in the form of the amniotic fluid, whether or not a proper amniotic fluid is being formed, how the baby is moving. All other features are also noted down and seen during this particular scan. We look at the baby's face, we look at the eyes, we look at the presence of the lenses in the eyes, we look at the nasal bone, which is very important marker, because absence of nasal bone may sometimes indicate that everything might not be all right with the baby. So that needs to be documented as well. We look at the lips of the baby, because some babies may have a small cut, what we call as a cleft lip. So that needs to be checked and ruled out as well. And if you are lucky, we can produce a good 3D photograph of the baby as well for you. So this is in a nutshell what we are seeing at the time of the TIFA. We are doing a thorough screening of the baby to look for any possible abnormalities which could be pointing towards genetic condition. This is in no way a complete screen, because no scan can give you 100% information, but to the extent it is possible, we try and rule out so that a healthy pregnancy is ensured for the couple. Thank you.